Hello students, we will be continuing with the internal structures of the pons. Before we see the internal structure of the pons, let us recap about the external features of the pons. In the external features, we see that on the ventral aspect, on the ventral surface of the anterior surface, we see that the pons is convex in both directions, and we have a bulbal sulcus, and the pons will continue laterally as the middle cerebellar peduncle. In between the pons and the middle cerebellar peduncle, we have the emergence of the trigeminal nerve, the motor root, and the sensory root. Rostrally, we have the pontomedullary junction, where the roots of your abducens nerve, facial nerve, nervus intermedius, and vestibulocochlear nerve emerges at the pontomedullary junction. At the posterior surface, it is covered by the cerebellum, and it is separated by the cerebellum from the cerebellum by the fourth ventricle, the cavity of the fourth ventricle, and the dorsal surface will form a triangular area forming the floor of the upper part of the fourth ventricle. Now the sections will be taken at two sections, one at the level of the facial colliculus and another at the level of your trigeminal nucleus. Now let us see a section at the lower part. At the lower part is at the level of the facial colliculus over here. So in this level, we see gray matter. Among the gray matter, we have the abducens nucleus. The abducens nucleus, it lies behind the facial colliculus, right in the floor of the fourth ventricle, just lateral to the medial longitudinal bundle. The motor nucleus of facial nerve will lie, ventrolateral to the abducens nucleus, and the fibers of the facial nerve will wind around the abducens nucleus over the producing the facial colliculus, and it will run in between the motor nucleus of facial nerve and the spinal nucleus of trigeminal nerve, and it will emerge at the pontomedullary junction just lateral to the abducens nerve. So you can see from this aspect, you have the abducens nucleus nerve here and the facial nerve on the lateral side of the abducens nerve. Another nucleus that you will find on this aspect is the superior salivary nucleus, superior salivary nucleus and inferior salivary nucleus. If you see a diagram on this aspect, you'll see the superior salivary nucleus here, inferior salivary nucleus, and lacrimatory nucleus. So this nucleus are seen at this level. And then we have the nucleus of tractus solitarius. It lies lateral to this superior salivary nucleus. On this section, we also see the vestibular nucleus, right? And we have the dorsal and the ventral nucleus of the cochlear nerve. Okay, situated dorsal and ventral to the inferior cerebellar peduncle. Then we have the spinal nucleus and the spinal tract of trigeminal nerves. Among the white matter, we have the trapezoid body, just dorsal to the basilar part of the pons, and this is because of the decussation of transversely running fibers arising from the cochlear nucleus. Then we have the medial lemniscus, spinal lemniscus, medial longitudinal bundle, pectospinal and rubrospinal tracts. These are at the level of the facial colliculus. These are the structures you will find. Now at the level of the upper part, the cranial part of the pons, this is at the level of the sensory nucleus of trigeminal nerve. So we take a section at this level, right? At this level, we take sections. So at this section, the tegmentum will show a small cavity over the fourth ventricle, which is bounded laterally by the superior cerebellar peduncle and roofed by the superior medullary velum. Now, the gray matter in this section in this area we will only find the main sensory nucleus of trigeminal nerve and the motor nucleus of trigeminal nerve medial to it. At this level, your 7, 6, 6, 7, and 8 nucleus, cranial nerve nucleus, will be absent. So these two nerves, this motor nucleus and motor sensory nucleus, the nerves will emerge on the anterior aspect of the pons, like you have seen on this diagram at this level. Right. So among the white matter, we have the from medial to lateral, medial lemniscus, trigeminal lemniscus, spinal and lateral lemniscus, and we have the medial longitudinal bundle, tectospinal and rubrospinal tract. When we see the clinical correlations, we have one is the Miller-Gubler syndrome, also known as the medial inferior pontine syndrome. Here it affects the pyramidal tracts and also the abducens and the facial nerves. So this region, the basilar part will consist of, it is the same at the level of the upper part, that is the facial colliculus, and at the lower part of facial colliculus, and at the upper part, that is the trigeminal nucleus. So it is all the same. It will consist of longitudinal fibers. It will consist of longitudinal fibers, and it will also consist of transverse fibers and pontine nuclei. Among the longitudinal bundles of fibers, it includes corticopontine, corticospinal, and corticonuclear. And among the transverse fibers, it includes your pontocerebellar fibers. The pontine nucleus, the small pontine nucleus, will form an important pathway of the corticopontocerebellar pathway. So if we are having a clinical correlation, in case of Miller-Gubler syndrome, it will affect your corticospinal tracts, and also this 7th and 6th cranial nerves. 7th and 6th cranial nerve. So if it involves the 6th cranial nerve, there will be ipsilateral medial squint. When it involves the facial nerve, we have ipsilateral facial palsy, and due to involvement of the corticospinal tract, contralateral hemiplegia also will be present. Another condition is the pontocerebellar angle syndrome. This usually occurs due to the pressure exerted on the lateral region of the pons by acoustic neuroma, a tumor which developed from the Schwann cells surrounding the cochlear nerve. Now, the characteristic signs and symptoms would include, due to involvement of the vesiculocochlear nerve, there is tinnitus, progressive deafness, and vertigo. Due to involvement of the cerebellar peduncle, there is ipsilateral ataxia and staggering gait. And involvement of the facial nerve would lead to ipsilateral lower motor neuron type of facial palsy. And involvement of the trigeminal nerve and trigeminal nucleus, it would lead to ipsilateral loss of pain and temperature sensation and loss of corneal reflex.